Assalamualaikum everyone. My name is Dr. Dilip Kumar. I am lecturer at the Department of Physical Therapy, Indus University. Welcome to Anatomy Tutorial Series. और ये सीरीज़ जो है हमने लॉन्च की थी एंड स्पेशल थैंक्स टू डॉक्टर ओकाशा अंजम. शी इज़ द चेयरपर्सन एट डिपार्टमेंट ऑफ फिजिकल थेरेपी इंडस यूनिवर्सिटी. ओके, दो से तीन रिकॉर्डिंग ऑलरेडी इस सीरीज़ की हो गई हैं जिसमें हमने क्लेविकल और स्कैपुला बोन को देखा था. टुडे वी विल टारगेट ऑन द ह्यूमरस बोन. पहले हम देखेंगे ह्यूमरस बोन के बोनी लैंडमार्क्स की, इसके बोनी लैंडमार्क्स कौन कौन से होते हैं. देन वी विल मूव toward the attachment like the muscles and other ligaments etc. attachment on the humerus bone. तो पहले मैं आप लोगों को बता दूं कि where the humerus bone is basically and what are the main or we can say that the general features of the humerus bone. Okay, this is a humerus bone and this is your right humerus bone. अगर clinical perspective अगर किसी भी point of view से अगर वाइवा में ही आपको अगर humerus bone let suppose दी जाती है and you are asked that which view is this and whether it is a right or left, तो how you differentiate firstly. कोई भी अगर ह्यूमरस जब आप ग्रिप करते हो तो what you have to see, वैसे तो ह्यूमरस में ये अपर एंड है, ये शाफ्ट है एंड दिस इज द लोअर एंड. आई विल डेमोन्स्ट्रेट ईच एंड एवरी लैंडमार्क, लेकिन मैं एक आपको जनरल व्यू दिखा रहा हूँ. ओके, हाउ टू डिफरेंशिएट बिटवीन द राइट एंड लेफ्ट. इफ यू सी क्लोजली, in lower end there are two small fossa. We will discuss the coronoid and the radial. ये हम डिटेल में डिस्कस करेंगे लेकिन जनरल. और पोस्टीरियर एस्पेक्ट पे सिर्फ एक फोसा होता है विच इज ऑलिकरनॉन. एक ये पर्सपेक्टिव हो गया. दूसरा पर्सपेक्टिव, इफ यू सी इन लोअर एंड द मीडियल एपिकंडाइल is more prominent rather than the lateral. This is the lateral epicondyle and this is the medial epicondyle. Medial epicondyle is more prominent. So when you hold a humerus and place this is the head of humerus which articulates with the glenoid, cavity of the scapula to form the glenohumeral joint. So this is how your glenohumeral joint is formed. The head of humerus which faces the medially and little bit backward in a glenoid spectrum. If you see the two small fossa at the lower end, it means you have placed very correctly. Let's suppose here you can see the two fossa. Okay, लेकिन अगर आपकी ये position हो, it would be wrong because the posterior aspect of olecranon fossa you can see. Secondly, check the face of the head of humerus which is in oblique direction. It must be in medial in order to articulate. Let me show you on this. If you see, this is a proper anatomical position on the skeleton. The head of humerus is facing in the forward direction, no doubt forward, backward and medially. In medial direction, this is how it articulates with the head of humerus, articulate with the glenoid cavity of the scapula to form the glenohumeral joint. एक तो ये perspective है. दूसरा, now moving toward the bony landmarks. दूसरा perspective ये है कि यहाँ पे जो main tubercles हैं, if you can see, this is the lesser tubercle and this is the greater tubercle. I will show you on this. If you can see, this is the, if I mark with the pencil, this is your lesser tubercle or lesser tuberosity and this is the larger one is the greater tubercle which is laterally. तो एक और पर्सपेक्टिव ये भी है कि जब भी आप ह्यूमरस को ग्रिप करें, जो आपका लेसर ट्यूबरकल है वो उसने एंटीरियरली फेस करना है. द लेसर ट्यूबरकल शुड बी facing anteriorly, which you can see from your perspective when it is placed in anatomical position. So when you place humerus in anatomical position, the lesser tubercle should be facing anteriorly. If you see, the most prominent bony landmark that you can see is the lesser tubercle. So this is a very proper position or very placed in a correct way, and this here you can see the lesser tubercle. While you see the laterally, if you see the laterally, this is the greater tubercle or greater tuberosity. Okay, let's move on back to the bony landmarks or general features of the humerus. So when you see humerus, this is your right one. It is divided into three parts. The firstly, this whole part is called upper hand. Let's suppose if I grip like this, this is the upper hand. What are the landmarks in upper hand? We will discuss it, okay, thoroughly. This is the upper hand. Then it has the winning shaft. This whole structure is the shaft, and then it has a lower hand. So if I grip a humerus like this is the lower end, my right hand, this is the upper end, and the whole remaining structure is your shaft of the humerus. So humerus is divided into the three parts. The upper end, then it has a intervening shaft, and then furthermore it has a lower hand. The every perspective or every aspect of the humerus have some different landmarks, have some different muscular attachment, which is a representation of that perspective, or what we can say the in anatomical perspective, at every aspect, at every segment of humerus there is some special recognition. So we will discuss it one by one. Okay, now moving toward the upper end. पहले हम upper end पे आते हैं, तो पहले हम सिर्फ general features के ऊपर focus करेंगे. If you see the upper end like this, the one of the most prominent structure you can see the ball, which is called the head of humerus. तभी shoulder joint को ball and socket joint कहा जाता है, because glenoid is like the socket. Glenoid cavity is like the socket, and the head of humerus reacts or acts as a ball. So this is the ball and socket joint basically. Okay, socket मतलब cavity. So the first structure that you see is the head of humerus. Head of humerus, in case of shoulder joint, it basically faces anteriorly and backward and medially. It faces basically medially and backward direction, and it articulates with the glenoid cavity. So this is how you can see the head of humerus. This is your head of humerus. Okay, that जैसे ही head of humerus खत्म होगा, you can see a line. If I mark with the pencil, here you can see, जैसे ही head of humerus खत्म हो रहा है, if you can see this, there is a line. This is called anatomical neck. So anatomical neck, जैसे ही head of humerus खत्म हो रहा है तो उसके बाद एक lining आ रही है. This is called anatomical neck, which basically gives attachment to a capsular ligament. वो भी हम देखेंगे. So this is called anatomical neck. There are three necks basically. एक होती है anatomical neck, then you have a surgical neck, और एक होती है morphological neck. हम डिटेल तीनों को थोड़ा सा डिटेल में देखेंगे. ओके, anatomical neck में मैं तीनों का पहले आपको फर्क बता दूं. anatomical neck सेपरेट करती है हेड ऑफ ह्यूमरस को बाकी जो रेस्ट ऑफ द ह्यूमरस है उससे. मिसाल के तौर पे दिस इज योर हेड ऑफ ह्यूमरस एंड दिस इज द anatomical neck. If I pencil with the mark with my pencil, so anatomical neck is basically separating the head of humerus on one side and rest of the humerus on other side. This is the anatomical neck. When you talk about the surgical neck, this is where a surgical neck lies. Here the surgical neck is basically. So what the surgical neck differentiate? Firstly, surgical neck is often in relationship with the axillary nerve. We are, if you see the clinical perspective, this is how a surgical neck where exists. Surgical neck at just bottom of the both these lips of the bicipital groove, जो कि हम पढ़ेंगे. तो surgical neck separate करता है पूरे upper end को rest of the body से. So this is how you can differentiate between the anatomical neck. Anatomical neck is only dividing the head of humerus with the rest of the body, but while the surgical neck is basically dividing the upper end of the humerus with rest of the shaft and the lower end of the body. So this is how. And finally you have a morphological neck, which is a junction point between the epiphysis and the diaphysis. जो कि epiphysis और diaphysis की जो junctional line होती है वहाँ पे उसको तो epiphysis और diaphysis में जो differentiate करती है, which is your morphological line. No doubt these all are the imaginary lines. Okay, so the head of humerus, then you have a neck, and then what you will focus the prominent medial. This one is the medial aspect. This is the medial side. So you will see some sort of the tubercle, some sort of the tuberosity. This medial side tubercle is the lesser tubercle. Why this is called lesser? Because there is a greater. उसके बराबर में एक बड़ा सा tubercle या speed breaker type structure पड़ी हुई है, तभी इसको lesser कहा जाता है. So this is the lesser tubercle, and here is the greater tubercle. So medially you have a what we can say the prominence. You have some sort of the tuberosity, which is called the lesser tubercle, and then on the lateral aspect you will see the greater tubercle. Here you can see this is the lesser tubercle, and this is what you have the greater tubercle. If you focus on the greater tubercle, you have a 3 impression on the greater tubercle. हम इसको थोड़ा सा अगर zoom में देखेंगे तो ये जो greater tubercle है, this whole structure is the greater tubercle, and this small is the lesser. तभी इसको lesser और उसको greater. और tubercle इसीलिए कहा जाता है क्योंकि medical anatomical terminology में tubercle मतलब किसी चीज से कोई चीज projection, किसी चीज की कोई चीज जब निकलती है projected करती है तो उसको, तो bone में से जो projections, bony projections को tubercle कहा जाता है. ठीक है, tubercle, tuberosity, trochanter, these are the anatomical medical terminologies basically. Okay, so you have a lesser and you have a greater tubercle. If you see on the greater tubercle, there are 3 impressions. If I place my fingers like this, if I focus on this, if I place my 3 fingers, so you have a 3 impressions: the topper one, upper one, the middle, and the lower one. So upper, middle, and lower. So you will find a 3 impressions, basically these 3 impressions are basically the for the attachment of 3 muscles, उसको भी हम डिस्कस करेंगे. ओके, तो अपर एंड में क्या क्या चीजें आपको मिलेंगी. द हेड ऑफ ह्यूमरस, you have an anatomical neck, you have a lesser tubercle, you have a greater tubercle, and in between them there is a groove, there is a sulcus. If you can see, I place my pencil in it. Okay, this groove is between 2 sulcus, that's why it is called intertubercular sulcus. Sulcus मेडिकल टर्मिनोलॉजी में किसी ग्रूव या किसी टनल को कहा जाता है. सो दिस सल्कस इज between these 2 tubercle, lesser and greater, that's why it is called intertubercular sulcus. Another name for this is the bicipital groove. Groove matlab again groove is same for the tunnel. Okay, another name for this is the bicipital groove. Why this is called bicipital? Because it gives a passageway to the long head of the bicep. Long head of bicep, which comes from the coracoid process, is basically passing through this tunnel, then come downward at the, now we are moving to terminate the upper end. अब हम upper end को खत्म करने वाले. जैसे ही अगर आप देखेंगे ये आपका lesser tubercle medial side पे, it has a medial lip. This is the medial lip of the bicipital groove, and जो greater tubercle से आ रहा है, this is the lateral lip of the bicipital groove. So bicipital groove has one lip medially and one laterally. Why they are differentiated? They give attachment to also some muscles. उसको भी हम one by देखेंगे. Okay, so when you focus on the upper end, this is how a medial lip, and this is the lateral lip, and this is the floor, or what we can say the bicipital groove. So this is what about the upper end of the humerus. Now we are moving toward the shaft. Let's continue with the shaft. If you talk about the shaft after the upper end of the humerus, अब हम shaft की तरफ focus करेंगे. तो as I have already mentioned, the shaft has the 3 borders: the anterior, medial, lateral border, and surfaces also. If you talk about the borders, you have an anterior border right way from the greater tubercle से right way to the mid of, in between these 2 fossa. These 2 fossa will be discussed in the lower end. This is the anterior border. Then you have a medial border. The right medial border is called because it is medially toward the anterior border. Anterior border के बिल्कुल medially अगर आप देखेंगे, the medial all way coming from the medial lip of the bicipital groove, and all way it runs downward, and it basically forms the medial supracondylar ridge. This is the medial epicondyle, and above it there is a medial supracondylar ridge. When you talk about the this is all the anterior medial surface, while the lower half, if you see the lower half of the anterior medial surface, it is basically in connection, or it gives attachment to the brachialius muscle. We will discuss it, which is the elbow flexor. Okay, now we are talking about the anterior lateral surface. This is the anterior, and between the anterior and the lateral border. Lateral border is only present in the lower end, which forms the lateral supracondylar ridge, and the surface between the anterior and lateral is called the anterior lateral surface. What we can say, the special recognition for the anterior lateral surface, firstly how it is, if you see the mid of the anterior lateral surface, अगर आप anterior lateral surface के बिल्कुल mid की बात करेंगे, upper part की अगर हम अलग से बात करेंगे, और अगर आप इसके mid की बात करें, तो if you will see a V-shaped structure like this. If you can see the V-shaped like structure. This special structure which is a projection also is called the deltoid tuberosity. Why this is called deltoid? Because of the deltoid muscle insertion. Just posterior to this tuberosity, exactly tuberosity के जो पीछे, if you see on the posterior aspect, there is a groove. All you can see, there is a groove which runs forward. Okay, there is a groove. Basically this groove is called the spiral groove, and it is also connected with the radial nerve. That's why it is also sometimes called the radial groove. So anterior lateral जो surface है, उसके अगर आप mid में देखेंगे तो आपको एक V shape structure मिलेगी, which is called the deltoid, or just posterior to it there is a groove which is also called a radial groove, and it runs forward basically. So it is also called the radial or spiral groove because it runs in a curve basically. Okay, this is how anterior lateral surface, and where it ends basically the lateral border ends at to form the lateral supracondylar ridge. Okay, now we are the shaft is completed, and shaft is also concerned with the some muscles. Okay, now we are talking about the lower end. So if I focus, this is your lower end basically. This is the lower end. In lower end you will see 2 fossas. The first फर्स्टली लोअर एंड में दो आर्टिकुलेटिंग स्ट्रक्चर्स हैं और दो नॉन आर्टिकुलेटिंग स्ट्रक्चर्स हैं. द आर्टिकुलेटिंग स्ट्रक्चर इट मींस दे टेक पार्ट इन ऑर्डर टू फॉर्म द जॉइंट, जिसको हम आर्टिकुलेटिंग कहेंगे. नॉन आर्टिकुलेटिंग विच आर प्रेजेंट बट दे डोंट टेक पार्ट इन द जॉइंट टू फॉर्म द जॉइंट बेसिकली. ओके, इफ यू सी a rounded structure, this is how, this is a rounded structure. If you see, this is the capitulum, this rounded projection on the lateral side. How can you differentiate between the medial and lateral? Medial epicondyle is more prominent and more projected rather than the lateral epicondyle. ठीक है, तो medial epicondyle ज्यादा बाहर की तरफ निकला हुआ था, तो this is how you can differentiate. This is the medial one and this is another aspect, the face of the head of humerus. The face of head of humerus would be the medially in order to form the glenohumeral joint. So this is your medial and this is your lateral. Okay, if you see the laterally a rounded projection is coming outward, a rounded projection, this is called the capitulum. Why this is called capitulum? And this is one of the articulating, this is not a, this is articulating structure. So there are the two articulating structure I was telling you. This is the capitulum. Okay, and the right above it, capitulum के ऊपर एक fossa होता है. ठीक है, अब now this is laterally, so this is a radial fossa. मैं आपको दोनों को याद करने का तरीका भी बता दूं. पहले मैं आपको आर्टिकुलेटिंग स्ट्रक्चर बता दूं. द राउंडेड स्ट्रक्चर, दिस इज द कैपिटुलम एंड लाइक अ पुली, और उसके आप मीडियली देखें, अ पुली टाइप स्ट्रक्चर इज आल्सो प्रेजेंट which is the trochlea. So these are the parts of the humerus, keep in mind. So you have a capitulum and you have a trochlea. The capitulum articulate with the head of radius and the trochlea articulate with the trochlear notch of ulna. तो हाउ यू कैन डिफरेंशिएट, रेडियस जो है वो लेटरली होती है, तो आप जो रेडियस बोन है वो आपके लेटरली थंब साइड होती है ना, जो आपके लेटरली होती है, तो ये जो लेटरली स्ट्रक्चर है इट आर्टिकुलेट विद द head of radius. So capitulum is laterally because it articulate with the head of radius, while the medially a pulley type structure is the trochlear, trochlea या trochlear process, and it articulate with the trochlear notch of ulna. Okay, now the two fossas are present over it. एक कैपिटुलम के ऊपर है, एक ट्रोक्लिया के ऊपर है. जो कैपिटुलम के ऊपर है, अब कैपिटुलम किसके साथ आर्टिकुलेट करती है? हेड ऑफ रेडियस के साथ. तो कैपिटुलम के जो ऊपर फोसा है, दिस इज कॉल्ड रेडियल फोसा. हियर यू कैन सी दिस इज द रेडियल फोसा. और जो ट्रोक्लियर के ऊपर फोसा है, दिस इज कॉल्ड द कोरोनाइड फोसा. सो दीज टू फोसा, द रेडियल फोसा accommodates the head of radius during flexion, while the coronoid fossa accommodates the coronoid process of ulna during the elbow flexion. This is how, if you see, this is your radius bone. Okay, this is the right radius. How you can see, this is the right radius. How can you differentiate among them? This is the styloid process of radius. Okay, which gives insertion to the brachioradialis. Okay, these are the forearm bones. If you see, this is how a laterally placed. Okay, here the basically head of radius is placed due to the some annular and different after the ligaments attachment. Okay, it comes in contact during the elbow. This is how your elbow flexion is going on. So it articulate with the radial fossa. So head of radius comes in contact during your elbow flexion. When you talk about the, and this is your ulna. Okay, and how you differentiate the medial and lateral side, this is the styloid process of ulna. Okay, you have to keep it medially. Okay, when you talk about this is the olecranon process and comes it goes into the olecranon fossa, वो भी हम देखेंगे जो कि posterior surface पे. When you talk about the trochlear notch of ulna, okay, it comes in contact just like when you do the elbow flexion, it comes in the trochlear into the coronoid fossa. This is the coronoid fossa. So how ulna comes in contact, and when you see on posterior aspect, this is the olecranon process and this is the olecranon fossa. Olecranon fossa एक होता है जो कि ह्यूमरस पे प्रेजेंट है. olecranon fossa मतलब olecranon depression, और olecranon process ulna का पार्ट है. So this is how during the elbow extension it comes into the contact when you do the elbow extension. Okay, when you do the elbow extension, this is a flexion, this is coming into the extension, and how it olecranon process comes in contact with the olecranon fossa. Okay, now let me show you on this. So if you talk about head of humerus, if I give you a quick review basically. So this is the hole is the upper end, this is the intervening shaft of the humerus, and this is your lower end. In upper hand, if you see, this is the head of humerus. ये head of humerus है, जहाँ पे head of humerus खत्म हो रहा है, जहाँ पे मैं पेंसिल का मार्क कर रहा हूँ, this is your anatomical neck, okay, which gives attachment to the capsular ligament. The most prominent which you will see from the anterior side, this is the lesser tubercle, okay, and right way on the laterally you have a greater tubercle, ठीक है, greater tubercle या greater tuberosity, where you will find 3 impression if I mark with the pencil. Oh, if you can see, there are the 3 impressions basically, the upper one, the middle one and the lower one. These impressions are basically for the muscular attachment, वो भी हम देखेंगे, and in between them there is a groove which is called the bicipital groove, और ये दोनों tubercle के बीच में है, तो this is called intertubercular sulcus, okay. Then you have a surgical neck like this. This is how a surgical neck basically, and this is the bicipital groove, and this lip is the medially. So this is the medial lip of the bicipital groove, and this is your lateral lip of the bicipital groove. So when you talk about the shaft, when you see from the anterior view, this is how a anterior border. Right way start from the greater tubercle to in between these two fossa, and medial border just medial lip, starting from the medial lip of the bicipital groove and coming toward the medial supracondylar ridge. When you talk about the lateral epicondyle, right way it is only present in the lower end and it forms the lateral supracondylar ridge, okay. So this is how a shaft, this is a V-shaped tuberosity, you can see in the anterior lateral surface, V-shape which is the deltoid tuberosity, and here it is a spiral groove. If I mark with the pencil, this is how a spiral groove. So this is all about the shaft of the humerus. Now just focus on the lower end. If I show you on lower end, this is your lateral aspect, because the radius is on right side, radius is on laterally, radius is laterally and ulna is the medially. So this is the lower end basically. This is your lateral epicondyle, because this is the lateral aspect. This is your lateral epicondyle, this is your medial epicondyle. ये भी एक पहचान है, medial epicondyle जो है वो ज़्यादा prominent होता है, ठीक है. There are the two fossas, okay. This is the lateral epicondyle. Lateral epicondyle के ऊपर वाला जो part है वो आपका lateral supracondylar ridge है. अब ये कंडाइल के ऊपर है तो इसको supracondylar कहा जाएगा. Ridge उसकी जो ridge projection को कहते हैं, तो ridge जो है वो projection, तो lateral supracondylar के जो lateral epicondyle के जो ऊपर है lateral supracondylar ridge, medial epicondyle के जो ऊपर है medial supracondylar ridge, okay. You have a lateral epicondyle, you have a medial epicondyle. When you coming from the laterally, this structure, if you see the rounded projection, this is the capitulum which articulate with the head of radius during your, if I show you like this, okay, this is how during the flexion basically how it articulate with this is the articulating structure, this is the capitulum, this is the head of radius, how it articulate with during the flexion to form a joint, okay. This is the capitulum, और capitulum के ऊपर जो fossa होगा उसको हम radial fossa कहते हैं. Why radial? Because the head of radius goes into it or accommodates into it during your elbow flexion. When you talk about the medially, this pulley type structure, this whole structure is the trochlear trochlea, and it articulate with the trochlear process of the ulna, okay. How it articulate with the trochlear, okay, and this the fossa above the trochlea, which is a non-articulating. There are the two articulating structure, the capitulum and trochlea, and two non-articulating, the radial fossa and coronoid. Trochlea के ऊपर जो fossa है, this is the coronoid, and it articulate with the coronoid process during the flexion, just like this. If you can see, this is the elbow flexion is going on. And finally, on the posterior side, you will see the posterior surface, which is basically between the anterior and lateral border, उसके बिल्कुल posteriorly, and it only gives origin to the muscles also, which is the tricep, okay. Posteriorly you see a long depression, this is the olecranon fossa. This is the olecranon fossa. And name ही indicate करता है, इसमें जो articulation होगी olecranon process of ulna. This is the olecranon process of ulna. When you do the extension, this is the elbow flexion. When you come into the extension, this is how it is basically locked. So olecranon process of ulna goes into the olecranon fossa of the humerus during your elbow extension. So this was all about the bony features of the humerus. Now we are moving toward the muscles attachment.